Hi friends, by clicking the subscribe and bell icon button, you can see all my videos without missing out any of my updates.
Hi friends, today we will learn about the fast hugs BID mnemonic. Fast hugs BID mnemonic is used for identifying and checking the significant aspects in the general care of ICU patients. It can be used as a checklist by every ICU nurse, doctor and other medical staff on a daily basis to find errors and make interventions or corrections on a daily basis for better quality care, thus facilitating the fast recovery of these critically ill ICU patients. Now let's see what Fast Hugs BID stands for. The F in Fast Hugs BID stands for feeding and IV fluids. A for analgesia, S for sedation, T for thromboembolic prophylaxis, H for head of bed elevation, U for ulcer prophylaxis, G for glycemic control, S for spontaneous breathing trial, B for bowel care, I for indwelling catheter removal, D for de-escalation of antibiotics. You might want to ask me a question. Why should I use such a mnemonic? Well, having checklists like Fast Hugs BID improves quality of care in ICU. It helps avoid medical errors. Safety and efficacy of care increases. Sometimes we overlook and don't even realize that we haven't fed a patient since 2 shifts. Or we may forget to add an antacid for another patient who now developed stress ulcer as a result. Regular checklists like Fast Hugs BID would prevent these kinds of errors and prevent us from overlooking significant general aspects of patient needs and improve quality of care. In other words, it helps the medical staff not forget important general care that a patient should receive. This checklist is recommended to follow by any medical staff so that they can find any omissions that might have happened unintentionally and to make any interventions or corrections on a daily basis for better quality care of critically ill ICU patients. Now let us see a short description of each aspect of Fast Hugs BID mnemonic. The mnemonic starts with the alphabet F. F is for feeding. When you see this, ask yourself whether the nutrition or IV fluids that is being given to the patient sufficient or insufficient to the patient. Malnutrition or deficient IV fluid administration delays recovery, increases complications or even worsens the prognosis of the critically ill patients. Ensure optimal feeding and adequate IV fluid intake. Make sure of the appropriate route of administration like oral, Ryle's tube feeding, PEG tube feeding, IV route, etc. Or check whether the patient is supposed to be kept on NBM for any procedure or surgery. Keep in mind any limitations like diabetes, fluid restrictions, internal bleeding, oral ulcers, acetylene diet, salt restrictions, etc. If any omissions or errors are found, intervene and take appropriate action. The second alphabet is A. A is for analgesia. When you see this, assess the pain of the patient verbally, or if he cannot convey his pain, use tools like pain scale for assessing the pain and give any painkillers if needed. Pain affects the cognitive and physical recovery, so enough pain relief must be given as needed like injection tramadol, injection nalbuphine, etc. Sufficient analgesic should be given and giving more of it should be avoided. Pain should be assessed by using pain scale or by monitoring heart rate, blood pressure, and basically by verbal communication. Pain can impair normal functioning. ability to do daily activities of living. Pain relief should be a major goal in a ICU setting. Next alphabet is S. S is for sedation. Unlike analgesia, sedation should be given as per the needs of the individual patients in ICU. It is used to calm the patient or to increase the synchrony of breathing in an intubated patient. It is used to reduce pain, to prevent anxiety, or to make invasive procedures like intubation, central line, etc. easier. On the other hand, excessive sedation has complications like venous thrombosis, decreased intestinal mobility, hypotension, and prolonged ICU stay. Next alphabet is T. T is for thromboembolic prophylaxis. It should remind you if the patient needs prophylaxis for DVT, deep vein thrombosis, which increases the morbidity and mortality rates. It is hence advised that ICU patients receive subcutaneous heparin unless contraindicated. Next is H. H is for head of bed elevation. Head of bed elevation can reduce hospital acquired pneumonia. Thus, optimally 30 to 45 degrees of head of bed elevation is recommended unless contraindicated. Next alphabet is U. U is for ulcer prophylaxis. Ulcer prophylaxis is very important for patients of respiratory failure or patients with bleeding disorders, stomach ulcers, etc. The commonly used ulcer prophylaxis drugs are injection pantocid, injection Rantac, syrup, sucralfate, etc. Next is G. G is for glucose control. When you see this, check if the glucose levels of the patient are being monitored on a regular basis as required. This is much more important in patients with DKA hypoglycemia. Glucose levels should be controlled within limits. Next alphabet is S. S is for spontaneous breathing trial. When you see this, question yourself if the patient needs further ventilatory care or if he can be weaned off by starting a spontaneous breathing trial like with pressure support mode, or if he can be extubated and can be given a trial of TPs, NIV, face mask, etc. accordingly. Next alphabet is B. B is for bowel care. Bowel care includes maintenance of proper bowel function, giving medications for constipation like suppositories, enema, etc. Digital rectal examination, rectal stimulation, and digital removal of feces. Medications for diarrhea like Sporolac, loperamide, enterogermina respules, etc. are given as needed. Optimal bowel care regimen is recommended for the well-being of the patient. Next alphabet is I. I is for indwelling catheter removal. Removing indwelling catheters like Foley's catheter and central line as soon as possible is recommended to prevent complications like COTY and CLABSI, that is catheter associated urinary tract infections and central line associated bloodstream infections respectively. And the last alphabet is D. D is for de-escalation of antibiotics. Watch out for de-escalation of antibiotics, which is the discontinuation of antibiotics or changing to a less narrow spectrum antibiotics. This is of utmost importance as antibiotic use would promote development of resistance. De-escalation is effective and is apt in a ICU setting when changed according to culture results. Thus, FastHugs BID helps in finding any omissions and errors so that you can intervene promptly, which helps in the fast recovery of the critically ill ICU patients. I hope you enjoyed the video. Please do like, share, comment, and don't forget to subscribe for more updates.